What should we do?
Get me the police.
Traffic accident, Doc. Abrasions, contusions, and knees all banged up, and it looks like possible internal injuries.
Don't listen to him. I feel terrific.
You'll be the judge of that, young lady. What's her name?
Annie Olansky.
And vital signs?
Pressure's 116/80, pulse is 84.
Well, that's not at all bad. We'll take good care of you, Miss Olansky.
Officer Olansky.
A police officer.
Do you mind, Miss Brancusi, if we take the patient inside? I'll be in a moment to examine her.
Yes, sir.
Thank you.
Believe me, I know what it's like to try and prove yourself as an individual in a masculine world. I bet you had an awful time.
Nah, it was easy. I'm a lot smarter than those guys.
Evening, doctors. Just the man I want to see.
Oh, not now, gentlemen. Another time.
Now, Mr. Slocum, it's urgent.
How urgent is it?
This urgent.
Good Lord, a bomb.
Not so loud.
A bomb? Oh, good Lord, what about the patients and the employees? Look, one thing we must not do is panic. We've got to evacuate the premises immediately.
No, not yet. Not yet. We called the police. The bomb squad's on their way over. They'll tell us what to do.
Yes, but we can't wait as long as there's a bomb in this building.
Arnie, if you don't stop shouting, we will have a panic on our hands.
You're right, you're right. The last thing we want is a panic. But this is a terrible thing, a very terrible thing.
Wait in my office.
How did this happen, officer?
Well, I was chasing this mugger across Market Street, and I got clobbered by a hit-and-run motorcycle.
Mm-hmm. Does that hurt?
No, not bad.
Oh, you see, that's why women make such great officers. They know how to cope with pain.
Not me. I hate pain. I just happen to feel good enough to get up and walk out of here.
Nevertheless, I think we'll keep this patient overnight for observation, nurse. It'll give us a chance to study your x-rays and make sure there aren't any nasty little surprises.
Oh, no. I mean, when the guys at headquarters hear about this, I'm never going to live it down.
Well, one thing's fairly certain, McIntyre. You're the primary target here.
Why me?
I don't know why, but he makes the point of mentioning you in this note, and you're the one he sent it to. Tobias, get the lab to work on that right away.
Yes, sir.
Don't you think it's about time we started evacuating the premises, Sergeant?
We'll get to that.
When? We've got over 1,000 patients in this building, and at least 400 employees.
There are two kinds of bombers, Mr. Slocum. One is a terrorist. He doesn't bother to send you warning notes. He just claims credit for the results. We're dealing with the other kind who likes to prolong the agony. That's why he tells you about it, so he can watch you squirm.
Why is he picking on Trapper?
Extortion, maybe. You'll probably get another note asking for something outrageous, or it might be just plain revenge. I want a list of every person who died in this hospital in the last year or so, and every patient, every fatality that you've been involved in, McIntyre.
Okay, you got it.
There may be an angry relative out there trying to even the score.
Sergeant Sykes, you seem to be much more interested in finding the bomber than the bomb.
We'll start looking when we stop talking. By the way, I want white coats for my men so they don't arouse curiosity.
This building is gigantic. Now, where do you begin a search like that?
We'll start right here in this office, then the operating room, the wards, and wherever else Dr. McIntyre spends his time.
Dr. McIntyre spends his time all over this hospital.
If that bomb goes off, we'll all be all over this hospital.
Sorry.
Well, there she is. Absolutely refuses to remain in bed.
Miss Olansky?
Officer Olansky, would you help me pick up some of this stuff, please?
Sure. I'm Dr. Gates. The nurses tell me you're practically uncontrollable.
I'm just trying to prove that I'm well enough to go back to work.
Work's pretty strenuous, isn't it?
No, not always.
Oh?
No. Listen, I don't believe in the macho approach to police work. See, I think we can accomplish a lot more if we just use a little psychology, a little brains, a little compassion.
That sounds reasonable. What kind of psychology should I use on you?
You should stop coddling your patient. If she feels strong, she is strong, and I feel fine.
The macho approach to medicine.
No, the psychological approach. You're demonstrating your faith in your patient.
Okay. Go on home.
You mean that?
Sure, go on.
Ah! Well, thank you very much. You're all right. Ooh. I'm sorry. You and your psychological approach.
We'll evacuate one ward at a time, starting with pediatrics, the OB ward next, then geriatrics.
McIntyre's office is clean, Sergeant. No bombs.
Okay, get to work on the other hot spots. I'll be right here if you need me. Doctor, what about that list of fatalities?
Medical records sent the files to my office. I'll get them.
Dr. Citron, please call recovery room. Dr. Carl Citron, call recovery room.
Oh, hi. You looking for me, Jackpot?
No, Doc. Just came by to pick up your noisemakers for your next party.
Oh, right. Well, take good care of them.
Yeah, okay.
McIntyre, that guy Slocum is driving me bananas. Can you please get him off my back?
Sure, but first, look at this.
Oh, what is it?
I don't know, but it wasn't here a while ago. I mean, I don't want to be paranoid, but,
Let me have your stethoscope. Stand back. I think it's okay. I think.
I hope you're right.
No plunger.
What the hell?
There's a note in here. 12 o'clock midnight. Gives us about 6 hours.
No, I think you're right about him watching us squirm. He enjoys it.
Yeah. And he does a pretty damn good job of it, too. Yeah? Something's ticking.
Why would anything be ticking in here?
Why not? It's as good a place as any.
X-ray technician on call, please call the emergency room. X-ray technician, call the emergency room.
Just what do you think you're doing?
Well,
I'm Dr. Stanley Riverside II, Chief of Emergency Services. May I have your name, please?
A Stone. A doctor.